Hi, welcome to Straight Talk. I want to welcome all of our new cities out there that are watching Straight Talk for the first time. And we always try to talk about issues that impact the community. And the biggest problem that we see that's impacting everybody is the issue of addiction. Whether it's heroin addiction, alcoholism, marijuana, you name the drug, there's a problem out there. And we usually just focus in on the addict. But today on Straight Talk, we're going to focus in on the family. Because when you have an addict, it impacts everybody. It's a family illness. And we're going to learn about it. And joining me is an addiction expert who works with families, Corinne Burnett. Welcome.
Thank you, Mike. Thanks for having me.
It's great to have you on the show.
Thank you.
This is your business. You deal with families all the time.
I do.
But when we talk about the family, that addiction is a family disease. You hear that all the time. Mm-hmm. What's that mean?
I couldn't agree with that statement more. I think that when there's addiction in the family, it absolutely touches each member of the family, particularly the ones who are in the home. There's so much uncertainty, I guess is one word that comes to mind, that you never know what you're going to get walking through the door. You never know when you're going to get a phone call that could be really upsetting. You never know if they're doing well or not doing well. It's just this constant uncertainty that leaves families feeling like they're walking on eggshells all the time, and has a number of effects from that for their own, mental health.
And that's regardless of who the addict is. I mean, if you've got a family, if the father is drinking too much, or the mother's drinking too much, or the kid's smoking too much pot, that's going to, disrupt the whole system?
Absolutely. The whole system. Whether it's a parent and the children are affected, the spouse is affected. If it's a child, whether it be an adolescent or even an adult child, the parents are affected. Siblings, absolutely. And I agree, when there's an addict or an alcoholic identified in the family, sometimes the focus is directed towards them, when actually the whole family needs to recover, needs to heal.
Yeah, I'd heard a statistic that somewhere around 26, 28 million children are living in an alcoholic family. Now you think about that, that's a lot. That's not even drugs, that's just alcohol.
Right.
So I guess you think about if you have a mother or a father who is an alcoholic, what kind of parent can they be?
Exactly. And so often, it gets kind of pushed under the rug, as long as the kids are getting to school on time, or as long as they're eating, as long as there's still a job, there's still an income. But actually, there's so much going on if there's an addicted parent or an alcoholic parent, that the child has so much chaos in their lives, and that can have a ripple effect in so many other aspects.
I mean, I can't even imagine what that's like for a child. You probably don't want to bring your friends home.
Right.
You don't want your parents showing up at the soccer game or taking you anywhere, especially if they're actively drinking.
Exactly. And that's so much to have to think about as a child. Yeah. The one thing that is, in my opinion, most important for a child is stability, and that stability needs to come from the parents. And when the parents are in constant chaos or crisis, or it's unpredictable, is Dad going to be sober at Thanksgiving dinner? Is he going to, show up to my soccer game, under the influence? Like, all of that worry is not, a child isn't able to handle that.
Plus probably violence.
Mm-hmm.
As well. I mean, do you see that, in your practice?
Unfortunately, yes, yeah. Tremendously. And, it's actually a very concerning thing, is that so many children who grow up in homes of addicted parents become addicted themselves. And one of the reasons that we believe this occurs is because there's something called ACEs, adverse childhood experiences, and that's kind of something that research is used to measure, like longitudinal studies, to measure outcomes of things like this. So ACEs could be physical abuse, emotional abuse, sexual abuse, or dysfunction in the home. And it's been shown that children who experience these things are much more likely to have addiction, to have mood disorders, anxiety disorders, risky behavior, other acting out behaviors. So it's a clear relationship there between, you know, growing up in this sort of dysfunction and then like the aftermath of that.
Yeah, and again, when you think about the dynamics of a family, it's almost like, you know, works in sync, and if one of those are out of sync, it seems like it throws everyone off, you know, in trying to have a system of something that works. But to have the kids have to go through that has to be the hardest.
Absolutely, absolutely. I mean, and you know, when children are developing, they're learning their ABCs, they're learning how to read, they're learning all this stuff. They're also learning coping skills, and they're also learning how to understand their emotions. And when there's addiction in the home and dysfunction in the home, it's not a safe place to do that. So a child in this type of environment might not feel safe crying in front of mom and dad if they're not stable. They might not feel safe getting angry as a child normally would. So they're going to develop all of these coping mechanisms that are not as healthy, and you know, there'll be consequences down the line.
Yeah, I think you put it well. Not healthy. It could be lots of different things, but they have to live. They have to cope because they're not getting attention.
Absolutely.
From mom and dad or whoever, and that's when they end up. When we come back, because you're going to be here, I want you to stay on, because I want to talk about identifying that. How do we help those kids before they end up, you know, doing something to hurt themselves or somebody else? So, thanks, Corinne Burnett, social worker, therapist. You're working in a great program here in Maryland, the Maryland Addiction Recovery Center, doing great work. So, thanks for helping us get started.
My pleasure.
When we come back to Straight Talk, we're going to continue talking about addiction in the family and what we need to do about it. So stay with us. We're coming right back to Straight Talk.
Why is Connor having trouble focusing in school?
Having trouble finding Connor's middle school? Would you like directions?
No, why is Connor having trouble focusing in school?
Finding lowest airfare to Istanbul.
No, I'm tired of fighting with him over homework.
Home, walk, restaurant. Need a review?
No, I need help. He's very smart, but his mind wanders. He's disorganized.
I think I understand.
Oh, good.
French fries. Finding best potatoes.
No!
Russet. Fingerling. Yukon Bowl.
Why don't you understand me?
Sorry, I was trying to show how Connor feels every day. Frustrating, isn't it? Redirecting to understood.org.
For the 1 in 5 kids with learning and attention issues, this is what life can feel like. Explore understood.org, a free online resource about learning and attention issues, designed to help your child thrive in school and in life. Understood.org, because understanding is everything.
So they say it's a man's world? Well, I don't see anybody's name on it. While they were out doing their thing, we slowly changed all that. We changed all that. Today, women can do anything men can do. And there's one thing we're even better at.
Hi, welcome back to Straight Talk. We're talking about addiction as a family disease, an illness that if one member of a family has a drug or alcohol problem, it affects everybody. And we're being joined today by Corinne Burnett, who is a social worker and works with families and works with young people, works with adults to see what's going on and to try to help people. So Corinne, thanks for staying with us.
My pleasure.
And hanging in there.
Thanks for having me.
We were talking about this family dynamic of when a parent is an alcoholic or an addict, what it does to the kids. When those things come out in kids, you were talking about behaviors that happen. Who sees that first?
So I think this is where school staff is super crucial.
Yeah.
You know, they get to see the kids 8 hours a day and outside of the home. So I think it's really important for teachers, counselors, any other staff members, even bus drivers, anyone who has, you know, that daily contact with the kids. If they see them isolating, if they see them withdrawn or outbursts, this is one thing that I think often gets unnoticed. You know, if a child is acting out, if they're behavioral, you know, what's wrong with the child? Do they need medication? You know, why do, you know, discipline, and I think we're missing a bigger picture of what's going on in the home. What's the child asking for? You know, are they not able to, like we were talking about, able to express any anger at home? Is it building up? Are they dying to be heard? You know, I think these things are key to pick up on, and us as adults need to really, it's our responsibility to give them a voice.
Yeah. It sounds like over the years we've focused a lot on abuse, child abuse, looking for signs and symptoms for child abuse. But you may not see those classic symptoms with a child who's going through this kind of trauma at home. It might be other things that are happening.
Absolutely, that's such a good point. Yeah, because it's not just you know, physical abuse or sexual abuse, although those often go hand in hand with addiction and alcoholism in the home. But it's just the dysfunction, the chaos, the neglect that's another adverse childhood experience that someone could have as a result of an addicted parent. And that's one that goes a little bit less noticed. Emotional neglect, just, you know, not being safe, not feeling safe in themselves and in their home.
And you might end up seeing them act out, like you said, act out in school, bad grades, not getting along, and people might look at it as something else,
Right.
when in reality it's addiction in that family that somebody needs to get involved with. And you're probably right, the school is probably the first line of identification when something's going on with a child. And then they may end up calling you or an agency like yours for help. How do you help a family like that?
So I think that's another key piece that I think we're just starting to take action on, which is that when an addict seeks treatment, that we treat the whole family, not just that one addict, because the whole family needs healing. Not only because they've been through the addiction alongside the identified patient, but the family, if they don't change at all, if the system that we talked about doesn't change at all, and the identified addict goes back into it, things are not going to work out well. That's what I've seen, is that if nothing shifts in the family and someone is just placed back in after they've recovered, things get much worse before they get better.
Yeah, and we probably see that a lot. You know, when, like you said, if the family's not moving and that person gets treated, then they're going back into a bad environment. And actually they're going to end up in trouble again, or something bad is going to happen. We talk about the parents being the addicted part, but you said there's a likelihood that the child is going to end up using. So now you got a kid who's involved with drugs and alcohol and a parent. I mean, that has to be very difficult for a therapist to work with.
Yeah. It's alarming how often I see adult children, patients, and they tell me that they started using with their parent. Or they were exposed to drugs or alcohol by their parent, and their parent is still currently using or drinking. And that can be really difficult. And, you know, we grow up with these messages, and they form these core beliefs within ourselves. And it's so hard to recover as an addict as it is. But if those core beliefs were set by someone who is in their active addiction, then it's even more hard to correct and even more difficult to correct. And it's really, I think, about getting those needs met elsewhere. If mom is not available because she's in her active addiction and you're trying to get better, you've got to find someone else to meet those needs of nurturing, of stability, of unconditional love. And maybe that's an aunt, maybe that's a sponsor, maybe, you know, that's in the meantime your therapist. But that is crucial, I think, in the recovery process.
Now, there are support groups for children of alcoholics, because as they get older, they find that some of their problems in life have to do with the fact that they grew up in an alcoholic family. So this stuff can linger on for years.
Absolutely, absolutely. I'm so glad you mentioned the support groups, because so much of the chaos and dysfunction of an alcoholic family is that you can't talk about it.
Right.
And that creates so much isolation, especially for a child, getting these mixed messages of like, this is going on at home, but I need to look this way outside of the home. And just having that community of knowing that you're not alone and that other children or adolescents or even adults, if it's a spouse or what have you, are going through the same thing can be so incredibly freeing and healing for that person. I think it's really invaluable.
In your practice and in the work that you do, when you get this family where there's denial and there's all these issues going on, do you have to kind of almost separate it?
Yeah.
I mean, I can imagine treating all of them together. That's got to be
Yeah.
so difficult. But your priority becomes, well, the child needs this and the parent needs that. And I mean, that has to be so hard. I mean, we always talk about addiction treatment as, you know, people out there are saying how difficult it is. This has to even be harder than, you know, just one-on-one with an addict.
Yeah, it is. It's really hard and it's very complex to do the whole family system approach, but it is so rewarding because you know that even if an addict relapses, if you've gotten mom to understand codependency and enabling behaviors, then you've helped mom cope with her addicted child.
Now, you know, we've got a lot of viewers in different cities, so if you're going to recommend, if you're going to say, if you think something's going on, if you're a teacher or a clergy or a friend of a family, you need to call help. They need to call a drug and alcohol program or a therapist, someone who's licensed that understands this, and get help for that family, or at least for the child.
Absolutely. And I think it's crucial that while there's family work being done, that especially the children, but each member of the family has their own safe person to talk to, you know? So even if I'm treating a family all together, I recommend that each parent, each member of the family is also seeing their own therapist, so that they can have a safe place to talk and process and not have to worry about what's mom going to do if I say this, or, you know.
Yeah. Well, when we come back, I want to talk about finding help.
Okay.
Because I think we can teach some people some things. So thank you. Corinne Burnett is giving us amazing information about addiction as a family illness. And we're going to talk about how to actually get some help. So stay with us. We're coming right back to Straight Talk.
Your daughter just had her first breakup. Do you A, put yourself in her shoes? B, console her?
Don't worry, sweetie. This is gonna happen a lot.
Or C, find her a new boyfriend?
Nice, single boys. That was weird.
As a parent, there are no perfect answers. But you don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org. Don't allow your weight to threaten your health or control your future. Excess weight or obesity can cause emotional and physical health risks. But you can take control. The Your Weight Matters campaign offers free resources and tips to help you measure and understand your weight. Take the Your Weight Matters Challenge. The free toolkit prepares you to speak with a healthcare provider about your weight. Your weight does matter. Take the challenge and take control today.
Hi, welcome back to Straight Talk. Again, we want to welcome all of our new viewers. We're talking about addiction as a family disease. And Corinne Burnett is a social worker who works in addiction, works with families, and is teaching us a lot about what the problems are. And now we want to talk a little bit about how to solve them a little, the best we can. But you were talking about having kids who are going through this trauma and how their behavior comes out, that we need to reach them. Tell us a little more about that.
Absolutely. I'm so often if there's chaos in the home, then the parents might be focused on that. If the father is an alcoholic, the mother might be so focused on just keeping dad okay, and the child might not get noticed for his or her needs. So they might act out in school, just begging for their needs. I mean, it's instinctual. It's their need to survive, and if their parents aren't meeting those needs, they're gonna find an adult to do that, and they will likely display oppositional behavior. It won't be, hey, I need to talk about what's going on in my home.
Yeah, like you said, people, it's such a secret, a dirty little secret.
Right.
We hide that all the time about addiction. Even now, as it's such a national issue, I think people still keep it hidden.
Absolutely.
Especially parents.
Absolutely.
Keep it hidden, and the child's not going to say anything.
Right.
So it becomes, so these kids have to grow up in different ways. I mean, if your father is an alcoholic, he's not going to be your father. So somebody has to be the father.
Right. Right.
And it might end up being maybe one of the kids.
Right. Absolutely. And it is sort of this double life that they have to take on, which is really stressful for a child. But yeah, I mean, they are going to get their needs met somehow. They're going to develop these coping skills. And sometimes it is a parentified child, maybe a sibling, maybe, someone else in the family is going to have to step up and be the stable one. And unfortunately, that role is the one that gets ignored a lot of times. If they're doing well, if they're holding it together, then that member of the family might not get treated the way they need to be, with the mental health and with counseling.
And their problems will eventually come out somewhere.
Absolutely. They're
Usually
internalized until they just can't take it anymore.
Right, eventually comes out. Now, finding help. If people are watching saying, yeah, wow, this is our family or my friend's family or something, finding therapists, finding a program, you're a social worker, that's a training, you're trained in family work. What should people do? Is it just pick up a phone call, find a therapist that understands addiction?
Yes, I think that is crucial. I think that we as a culture and a society are getting better at having no wrong door. At any avenue you take, people are more and more willing to direct you into the right, getting the right help. But you have to be honest. So often there are missed opportunities because the families are so used to keeping things hidden, like you were saying, that when they sit in front of a therapist or a counselor or a clergyman or whatever avenue they take, they'll mention everything but the substance abuse because that's a secret. And then they can't get the help they need. So the one thing I would stress, I don't think there's any wrong avenue to take, but just being honest, You
mentioned at the very beginning of the show about school personnel, and I mean, when you think about who interacts with a family, you just said just now the clergy. It's another avenue of how to identify what's going on, because I'm sure if you look, there's things going on. There's signs and symptoms.
Right, absolutely.
That you're going to see.
Yeah, I think so like we were talking about, so often children who grow up in addictive homes become addicted themselves later on. But what we found is that before that even happens, you'll see an anxiety disorder or a mood disorder. And it's been shown that if you can intervene at that stage, the substance dependency doesn't even necessarily have to happen. We can cut it off if there's that intervention and these disorders are addressed.
But something's going to pop out.
Right.
Behavior-wise, something's going to be obvious to somebody, but somebody has to pay attention.
Right.
But you're recommending, your suggestion would be what? Call for help.
Absolutely. Anywhere. You know, I'm a big advocate for 12-step programs. And in those 12-step programs, they'll likely help guide you to another level of care if that's what's necessary. You can get a lot of information that way. Talk to your primary care physician, but you have to be honest.
Right.
You know, just
Clergy is another
absolutely.
that you can talk to.
School counselor.
You know, I was reading about this adult children of alcoholics, that there's so many adults who were trying to figure out why things went wrong in their life or relationships, and they were able to kind of pull it back and realize it came from what you said, that dysfunction that was going on. And those are groups out there. There's a lot of support groups for people that have had that experience of addiction, but they have to obviously make that first step. Right.
It's all about taking that first step. I agree. Like, there's no wrong direction, I think, as long as you're doing it honestly and willingly. I think that there are so many avenues you can take as long as you're willing to put in the work, because it's a lot of work, and but it's crucial, and it can be life-changing for the whole family.
Yeah. I mean, you do amazing work, you know, in the sense of, I mean, this is the hard part of the work. I mean, getting families who are dysfunctional, who aren't willing to participate, you know, and here you are, the therapist, trying to piece it all together. But that is what a therapist does. I mean, that's what people need to understand. A therapist is there to help.
I think I'm really glad you brought that up, because there's a common misconception. If I go and say all this to a therapist, or if I let my kid go and say all of this to a therapist, they're going to judge me, they're going to think I'm a terrible parent, they're going to take my kid away, all of these things, and really have to put that aside and just be honest. And like you said, the therapist isn't there to judge or criticize, just there to help the family. And your family needs to be worth it to you. I know it is, you know. You just have to keep that in the forefront of your mind when you're going into it. Yeah, and things won't get better on their own. Exactly. Right. Anyway. Right. Corinne, thank you so much. You're a therapist, a social worker at the Maryland Addiction Recovery Center in Baltimore, doing amazing work. But for anyone out there in any city that's watching, just look up a good therapist like Corinne and find out, you know, how good they are. If you want to talk to Corinne, she's at the Maryland Addiction Recovery Center. I'm sure she'll be happy, but thank you so much. This is such an important show. Thank you so much for having me. It's been a pleasure. Keep up the great work. Thank you. Well, in Straight Talk, we're talking about addiction in the family, and we looked at signs and symptoms. If you suspect something is going on, or you know someone that needs help, make that call and get them help. I want to thank our guest. Thank you for watching Straight Talk, and we will see you next time.